Pineal Stories is intended for information and educational purposes only. The content shared on this podcast should not be taken as medical advice. We aim to raise awareness and foster thoughtful discussion around symptomatic pineal cysts. We are not providing medical guidance or diagnosis. Always consult a qualified healthcare professional regarding any medical concerns or decisions. Every individual situation is unique, and only your doctor can help you determine the best course of action for your health. Hey everybody, thanks for joining us again. Today we're with Nicole, who has had a really long and difficult journey and is pre-surgical but hopeful.
My name is Nicole. I'm 35 years old, currently a resident of Waiahu in Maui, Hawaii, in the country of USA. I'm currently technically disabled, partially due to my pineal cyst, or mass, as we are calling it, partially due to other medical conditions that are not related to the pineal cyst. I am able to be a part-time caregiver, about 10 hours a week, depending how I'm doing from week to week. And I feel very fortunate that I have a part-time occupation that allows me the flexibility and understanding to be able to take time off when necessary. I was a former florist. However, unfortunately, due to all of my medical symptoms and episodes, I've no longer been able to keep up with that as an occupation. So I am now in the process of figuring out a lifestyle and occupation that I can manage within the constraints of my medical situation. And that is an ongoing process, work in progress, and kind of just taking it day to day. I probably won't get it all figured out today or this week, but just taking it one step at a time and hoping that at some point eventually I'll be able to manage my symptoms enough to the point where I can pursue a career path and that, my future is a little bit more in my control. So that's the goal that we're working towards. And I'm really hoping that with the advancement in the medical community and the work that Dr. Patel is doing and this community raising awareness will be a helpful tool for me to reach this goal, which I'm feeling really good about, really positive and hopeful about. So my symptoms first began in the year 2009, 2010, with increased symptoms beginning to occur in 2016. My initial symptoms presented as pressure headaches with auras and eye pressure that resembled migraine attacks. These headaches started to become more frequent and severe, oftentimes leaving me bedridden and unable to even open my eyes. Eventually, the headaches started to be accompanied by other debilitating symptoms, such as severe tinnitus, that would often keep me from being able to sleep at night, severe episodes of vertigo, blurry vision, inability to focus my vision, and depth perception issues that would result in me walking into doorways and hitting my head. Unfortunately, I'm unable to have a good understanding visually of how far away things are from me. So I walk into doorways and hit my head on the car, getting out of my car and things such as that. And of course, that's more of it's pesky, it's, inconvenient, it's not fun, it's not necessarily dangerous per se, but yes, it's annoying. It's another annoying thing that makes me feel insecure about myself. And eventually these bouts of vertigo began to happen more frequently and became more severe, sometimes lasting for days at a time. And they were accompanied with intense episodes of vomiting. Eventually, I also began to have issues with dropping things. And at one point, I had dropped and broken 3 mugs in the span of 1 week, which is what initially sounded the alarm, so to speak, and led to my first brain MRI. So that was the first symptom that really sounded the alarm and led to the discovery of what was going on in my head. And it turns out it wasn't all in my head. This is a real thing. I had one syncope episode in 2019 where I briefly lost consciousness spontaneously. I was in a position and sitting in a chair and lost consciousness suddenly. My body went limp and I hit my head on a railing, resulting in a black eye and double vision that lasted for 24 hours, but then resolved on its own. Then in 2023, I had my first true seizure. During this episode, again, I was just sitting down casually, and then I started to just feel funny. My lips began to tingle. My vision kind of went in like a tunnel state and then went fully black. I lost full consciousness and became unresponsive. And I even stopped breathing and began to turn blue. During this episode, I did not experience convulsions. And after a few minutes of being unresponsive and not breathing, I began to come back to a conscious state and started gasping for air. Thankfully, I did have 2 friends present with me when this episode happened. So they helped hold me up and they kept me from hitting my head. And then once I began breathing again and my vision came back, I was actually still unable to control my body or respond to them verbally at this point. And it was at that point that I was actually hit with severe nausea and began to violently purge, almost choking on my vomit due to the way I was also simultaneously gasping for air. That was really scary. That was the point where I started to feel really afraid of what was happening and if I was actually going to end up surviving this episode and being okay. Thankfully, my friends were there. They held me in an upright position, held me forward, which prevented me from choking on my vomit, which I'm so thankful that they happened to be there. Once I became stable enough, my friends drove me to the emergency room for a workup. I was still disoriented and struggled. I wasn't able to walk. I needed a wheelchair. And I was able to respond verbally, but was still really disoriented. And, just didn't feel right. It took me a few days for that to resolve. When I was in the ER, there was nothing concrete found during their workup to explain what caused the seizure. They monitored my heart and found no abnormalities. Thankfully, I've not had another episode like that since. And as of now, that appears to have been an isolated incident, and I'm really hoping it stays that way. I'm still experiencing severe pressure headaches pretty much on a daily basis. They're worse in the morning, consistently, always, most severe in the morning and seem to sort of resolve and become less severe throughout the day. I'm still having visual disturbances, extreme fatigue, intermittent bouts of vertigo, some short-term memory issues, fullness in my ears, which makes me feel like I'm underwater, tinnitus, and superficial sinus pressure and congestion that I actually just saw an ENT to address last week. We reviewed my imaging, and the ENT determined that these symptoms are not being caused by any sinus disease or physical malformations. The ENT believes that these symptoms are being caused by something else that is mimicking sinusitis and sinus pressure headaches. So, although I would have preferred for him to have found sinus disease and to have sinus surgery rather than brain surgery, it's still helpful for me to have some clarity and to do this process of elimination where I can now take these findings and go back to the neurosurgeon and let him know that we've ruled out sinus disease as the cause of these symptoms. During these episodes, I've started to become completely debilitated. I'm unable to drive a lot of the time, unable to work. I'm still currently struggling to even maintain basic daily function to the point where basic self-care is difficult or even impossible. Obviously it's not the same every day, but I'm debilitated to this point more often than not. Things such as getting dressed, taking a shower, brushing my teeth, keeping myself fed, all of these basic things to function and take care of myself on a daily basis are oftentimes overwhelming tasks that I'm not able to perform. The dizziness and feeling of fainting often prevent me from being able to drive. And I'm oftentimes left completely bedridden due to the intense pressure headaches and fatigue. Due to the hearing issues, I'm unable to maintain some of my hobbies, such as singing and playing music. And that's been hard to cope with because, these pleasurable hobbies are, a big part of coping and keeping my mental health intact. Sure. And I'm also unable to keep commitments and have follow through with commitments. Often have to cancel appointments, meetings, and social plans. And that's a huge challenge because how do you live your life when there's no consistency and there's no way to know if you're going to be able to follow through with commitments and daily life. So I do my best with that, but it's challenging and definitely leads to self-worth struggles when I'm unable to have follow through. So fortunately, I did have a care team that took my symptoms seriously, and my diagnosis was actually quite prompt. I was being followed by a neurologist for about 2 years at the time where these concerning symptoms started to present. And my neurologist immediately ordered a brain MRI, and yearly brain imaging and follow-up appointments were established as my care plan once the pineal mass was discovered on my first brain MRI. So it was, initially discovered when the apparent migraine episodes started to be accompanied by other symptoms, like I said, such as dropping things. And when I had broken 3 mugs in the span of 1 week, that kind of raised the alarm to where my neurologist said, yeah, we need to do brain imaging and make sure there's nothing going on in your head that we haven't discovered yet. So, I do have a background of other medical conditions that sort of muddy the waters and have made it extra challenging to figure out what's what. And rule out that these symptoms may be attributed to my other conditions. So I do have autoimmune disorders, Sjogren's being my primary diagnosis, and I do have MS in my family. So when I started to present with these symptoms, my neurologist said he wanted to do brain imaging to rule out any demyelinating lesions, and MS type of things, to make sure that that wasn't causing the headaches and the symptoms that I was having. Um, so, upon my first brain MRI, I did have a classic MS type lesion on the corpus callosum. That is another finding that we have concrete evidence of on this imaging, that was immediately dismissed as asymptomatic.
Hmm.
And then after we discussed the brain lesion, then he presented me with the finding of the pineal mass, which he also described as being asymptomatic and dismissed as being the cause of the symptoms I was experiencing.
Right.
So at that point, our plan was to just, do yearly imaging and monitor the mass and make sure everything was stable. So I've had, about 15 years of wait and watch and yearly monitoring. And a myriad of different doctors and different specialties, and a pretty large care team trying to manage things and figure out what the best plan of attack should be.
Mm-hmm.
And it gets frustrating because I often get, beyond being dismissed, I'm getting passed back and forth between all the different specialists, and they're all saying, not my department. But there isn't really a doctor that's taking responsibility. Aside from, thankfully, my neurosurgeon, who I at one point challenged about a lot of this stuff, and he was receptive, and we had a good conversation about the reality that this mass may be causing some of these problems, and that there may be more to this that the medical community is not keeping up with. Um, and during this process, it was, frustrating because I'm having these symptoms, my quality of life is being hindered, and I'm being told that, what we're seeing on these images does not explain my symptoms.
Right.
And yet they don't have an explanation for my symptoms. And so that gets really frustrating. Um, you know,
Just to say it, kudos to that neurosurgeon for even acknowledging that there could be something, because that is not a common story.
yeah. Doctors are finding good care on the island of Maui is not easy. And so I just feel really blessed that I lucked out with Dr. Talagani, my neurosurgeon, who is very good. And with a lot of these conditions that I'm dealing with, it's imperative that the doctors overseeing my care don't just look at labs and imaging, but also listen to what I'm saying and complaining about. Um, and so I have been blessed to have a couple doctors among my care team who are taking that approach and looking more outside the box and validating my symptoms that I'm complaining about, rather than just going based on lab orders and imaging. And so, they were initially saying, this is incidental, this is asymptomatic, this is not causing your problems and your symptoms, which, some doctors are in agreement, and other doctors, such as Dr. Talagani, are kind of coming around and admitting, we don't really know if this may be causing some of your symptoms. So Dr. Talagani wanted me to see a neuro-ophthalmologist. He wanted me to get a second opinion. So I did have a second opinion from a neurosurgeon at Columbia Brain Tumor Center in New York City. That neurosurgeon was a lot more, I guess you could say, typical as far as the way he conducted our consult, how he was like not as compassionate, didn't really spend much time with me, and he was just very dismissive, which was disheartening, but learning that that's sort of par for the course.
It really is.
Yeah. So I was initially told that that it was a cyst, that it was incidental, that it's a lot of times people have this type of thing and they don't even know about it. That I didn't need to worry, that it wasn't serious and that it was asymptomatic. And it wasn't until around 2018 where this Dr. Talagani, my neurosurgeon on Maui, started to express concerns regarding the size of the mass. It's stable. It is growing, but it's growing very small, very, very slowly. Give or take about 1 millimeter a year in a different direction. And so around 2019, my neurosurgeon and I had a discussion about how the reality of the situation is that there's no way to truly determine, is this a cyst? Is this a benign tumor, pineal cytoma? And the imaging can't give us a definite answer on that. And so at that point, we stopped calling it a cyst and it began being referred to as a mass. And at that point, we also had a discussion about how, due to the size of this mass, Dr. Talagani thought that it was a possibility that it was not a cyst and was more along the lines of some type of benign tumor. He also, at this point, sat me down and explained that I'm not really like a typical patient that he takes on. Normally, as a neurosurgeon, he sees people 1 or 2 times, performs a surgery, and then they go on with their life. He doesn't usually have patients that he sees regularly every year in a long-term care situation. And he explained that the word he used was that I am in an annoying situation where he can't say nothing to worry about, see you bye. But we're not at a point where there's a clear path of treatment. And he did sit me down and explain to me that I'm right on the line where if this mass gets any larger, it would warrant emergent surgery. So at that point, he recommended a specific technique if that were to happen and I needed surgery, and it's the technique that Dr. Patel is using. And he explained that we do not have the technology and the equipment in the state of Hawaii to perform that procedure. So he advised me to sort of get situated with the different surgeons somewhere on the mainland and have everything established and in place in case that were to ever happen where I did need surgery. So I began that process. That's where I found the neurosurgeon at Columbia. I wasn't impressed. Continued to sort of try to network with other people. And that's where I discovered this Facebook support group, which led me to Dr. Patel. And now I'm in the process of trying to get in with him. So hopefully I can get insurance authorization and get the ball rolling on that because it's pretty clear that he's the guy.
He is absolutely the guy.
Yeah, and it's incredible that we have that because over this 15-year experience, that's never been part of this reality, is like having somebody to feel confident in to go to about this. So Dr. Patel is really changing the game here for all of us, and that's I'm really grateful for that. I'm feeling very hopeful. And I've seen a large handful of doctors regarding the pineal mass. I had my initial neurologist in Boston. I moved to Maui in 2013. I've been followed by an ENT and a neurosurgeon there. Spent a year in St. Louis, where I was monitored by a local neurologist there. And then I went back to Maui, reconvened my care with my existing ENT and neurosurgeon, and then got a second opinion in 2020 from the guy at Columbia. And so I've had a lot of different doctors weighing in on this, which makes it a little confusing. Not everybody says the same thing, and so it's hard to know like who to believe. But at this point, I kind of have more clarity about the doctors that are putting more effort to keep up with current medicine and information and are not taking like the lazy route.
Right.
And so that's having that clarity has been helpful. And I'm definitely feeling closer to having some resolution, which is amazing. When I saw the ENT in 2018 regarding my vertigo episodes, I had a vertigo test and I had some hearing tests and the vision test where they put like all the VR thing on you and they measure your eye movements.
Mm-hmm.
And this ENT also sort of took the lazy route, and I checked enough boxes for him to just dismiss it as Meniere's disease. Although some of the findings were not consistent with Meniere's disease, and there were additional abnormalities found on this testing that could not be attributed to Meniere's. One of the findings, coincidentally, was an upper nystagmus on my eye movements, which is classic clinical presentation of Pineal syndrome. And when I read the report, Pineal syndrome stuck out to me because it was familiar, and I'm like, why is that familiar to me? So then I just so happened to, be doing a spring cleaning and organizing all of my medical records about a year ago. And then in that process, I came across a brain MRI from 2018 that mentioned that this mass was showing a mass effect on the tectal plate and recommended evaluation for Pineal syndrome. So somehow these things are slipping through the cracks, and my specialists are not making these connections, which again is frustrating. I'm having to micromanage my care on my own, even though that just keeping up with basic daily life and self-care has been a challenge in its own. Now I'm having to micromanage my medical situation. And that's not how it should be, but unfortunately that is the reality.
Yeah.
So I am doing my best. I did try different migraine medications for a while. I believe Topamax was one of the medications we tried. There was another sumatriptan, I think I want to say. None of those medications were successful in treating my headaches. I did go to physical therapy to try to address the vertigo and the dizziness, on the off chance that it was maybe related to something with my cervical spine. And I have to say my vertigo has improved compared to 2016 to 2020. It doesn't happen as often. It's not as severe, but it does still come. It seems like, the symptoms are they fluctuate and they present differently depending on the day, which, is one of the bigger challenges with the pineal masses and cysts, is that there's so many different structures in that area that there's not a clear cut and dry presentation of symptoms. It can really present in so many different ways. And so I understand that that is a challenge, but that's something I'm hoping to participate in, making improvements on understanding the symptom presentations and how to get a better diagnosis or more efficient diagnosis.
Absolutely. We all have something, everybody's got something. And so it's really seems very easy for these doctors to say, well, that's that other thing. And in your case, you have some significant stuff, truly significant stuff going on. So that's got to be very frustrating. And that's rough. But before we get too far away from it, I do want to say that if you have the opportunity to meet with Jared Nix, some people have said that they're like, no, let's just hold off, and I just want to meet with Dr. Patel. No, meet with Jared next, because that's your doorway. That's
Okay.
the way to, and he'll take everything and his vast knowledge of patient interaction side of the house and take that to Dr. Patel. And it's what we did, and it's what most people wind up doing. I think it's really hard to make your first appointment with Dr. Patel, even though some people have tried to insist. We've, pretty well established that that's not the way to do it necessarily. So
Yeah, it's hard to do because he gets so many requests. He's really one of the only ones that does this in the United States. So it's awesome that we're going to be able to talk to him and Jared.
yeah, we're going to interview them for this podcast.
They've already set up a date and everything.
Yep. And this episode will actually air 1 week after theirs. So we're saying this out of order.
Gotcha.
Okay, there we go. Okay. Sorry, we had a little glitch there for just a second, and we're back.
We're back. Yeah, it's very, obviously it's nerve-wracking to think about the reality that it's probably inevitable that I will be having brain surgery. But it's also hopeful. It's the first tangible resolution that I've had during this 15-year process. Um, and that's huge. It's huge. And after the 15 years of being dismissed and gaslit, to finally be validated is it's a good feeling.
That's something we've noticed, well, in ourselves first, and then in others as we've done these interviews and just talking online to people. And, what other group of people are cheering at the fact that they get to have brain surgery?
Right.
And would do it all over again.
Yeah. Everybody that's done the surgery, those people have said, yeah, I'd do it again.
Literally gave me my life back. And that's not an exaggeration, because I was existing. I was breathing, but I wasn't really living anymore.
Breathing, not living. Yep.
Yeah.
Yeah, and that is, that parallel in my life is just really come to a head in the past year, I would say, to the point where, it was impacting my mental health. I reached out and began working with a therapist, and she's, it's been helpful, just to kind of reframe things and to understand that, I'm not weak. I'm not making this up. Um, this is a very difficult thing to live with, and I should give myself more credit because I'm managing it very well, all things considered, and I'm I'm strong. I'm not settling. I'm advocating for myself. I'm arming myself with tools and knowledge, and that's the most we can hope for. However, I did get to a place where the hopelessness and the self-worth issues that came with being completely debilitated and not functional in my day-to-day life um, made me feel worthless and hopeless, and started to really just make me wonder why I'm here. um, what's the point of all of this? If, I'd have no quality of life, and there's no treatment options being offered to me. Um, and so what's the point? Where do I go from here? Um, and so being able to discover this community of other people and read the testimonials, and um, you know, Dr. Patel is, his research and his case study and that he's made accessible to the community is really opened the door for the possibility that this isn't permanent and there is hope. And this is all, go ahead, sorry.
No, sorry about that. I was just reflecting on our situation. And when we got to that point where there was actual hope, driving to South Carolina from Texas 3 times and doing all this stuff, it was nothing. It was a piece of cake because what that represented was so hopeful.
Yeah, and I realized that even my neurosurgeon on Maui, who I did feel like, he was receptive, and I felt heard and I felt validated. But even Dr. Talgani, I think, was framing it backwards. His main hesitation for suggesting to have this surgically removed was that, I'm young and the surgery is risky and it comes with a 20% chance of stroking out on the table. And so if I can tolerate the symptoms without needing surgery. That was his suggestion. And that's valid. I understand, that's a liability to take on. That's a real risk that I'm gonna have to, I'm gonna have to try to swallow and come to terms with, but I'm looking at it a different way. The 20% chance of stroke during the procedure is a little scary, of course. However, that means I have an 80% chance that I'm going to get my life back. So I'm not really, I think the 80% chance of reclaiming my quality of life far outweighs the 20% chance of potentially having a stroke.
I feel like Dr. Patel is skewing those numbers as well, because even when Kelly had her surgery, he had done 200-ish, and now it's significantly more, and
with
he's
no
batting
adverse
1,000.
issues.
No problems, except for some people had short-term vision issues, because it takes everything time to settle back in. Kelly had some of that as well,
But it resolved
and it resolved,
eventually, yeah.
So
That's worth it
Yeah.
if you get your life back and your
Sure.
symptoms
Yes.
resolve. And it sounds like, like you were saying, that the the risks that have been presented are maybe inflated
Hmm.
at this point, with now what we know with what Dr. Patel's been working on. But even still, like, in a lot of ways, the level of debilitation that I've experienced is actually helpful. It's liberating because I don't really have anything to lose. And that makes it easy to decide, let's go for it. There's things can't, I'm not afraid of things becoming that much worse because they're already so bad.
Mm.
I feel like because of how debilitating this has been for me, it makes it a lot easier to make the decision, like, yes, let's do this. I like these odds. I don't have anything to lose. Let's try it. We have, what do we have to lose here? Let's just try it and see if my symptoms resolve, and hopefully I get my life back. So
We definitely understand that. And um, I, I know I've been cheerleading here a little bit. And just to be clear, this is not an ad for the Medical University of South Carolina or for Dr. Patel. It's just we happen to very much appreciate his work. So, the whole point of the podcast is to present these and get this information out there and get other neurosurgeons involved in the process and spread this around the world so that there's more than 4 people specializing in it. He's Dr. Patel here, 2 in Germany, 1 in Australia. And thank goodness he is helping to train the next generation of surgeons, because we need it. I mean, if you run the numbers on this, there's about 8 million people suffering from this right now, and 4 surgeons.
right, and it's interesting because it's the literature presents this as a very rare condition, but then in the same breath they contradict that by saying it's a common incidental finding. That's confusing. How can both things be true?
I think they're saying that it's common to have the cyst and it's rare to have a symptomatic cyst. But just looking, I mean, we just kind of looked at the numbers, and this many people have cysts, and this percentage of those people will show symptoms. And it's pretty simple math to come up to that 8 million.
But doctors just don't know enough, and so they blame it on something else. And Dr. Patel, with every surgery he does, is proving over and over again that these can and do cause debilitating symptoms. I mean, every single surgery he's done, that's a testament. Every single surgery he's done, every person has said they would do it again. because they got symptomatic relief from it.
Yeah, and from the newer information and testimonials coming out, it appears as though there are cases where some of us are experiencing intermittent intracranial pressure changes in hydrocephalus that's not being caught on our yearly imaging.
Mm-hmm.
And so that was really validating to read about how that's, starting to be documented and validated, because I've been, suspecting that that's been my experience this whole time. And to have those experiences, get those really intense bouts of vertigo and nausea and pressure headaches, and then the imaging's not picking it up, you do start to feel crazy, even though you know that the symptoms you're having are real.
Right. That's totally true, because it can fluctuate. I have so many MRIs at this point, and it's interesting because some of them showed worsening aqueductal stenosis, and so I also had some bleeding in the retinas, and that would the stenosis would come and go on the MRIs. Sometimes, I mean, the cyst was always there until the surgery, but the physical effects in the brain fluctuated from MRI to MRI, and the visual disturbances fluctuated during that time as well, before surgery. So yeah, you're right. It's not going to be exactly the same every day, on those images.
Yeah, and I just, I feel grateful that during my vertigo testing procedure that they did pick up the abnormal eye movements, because I think that's going to be compelling as far as, validating that I am experiencing tectile plate mass effect.
Mm-hmm.
Because, some of my MRIs are, the radiologist is reporting mass effect, some are saying it's not. And I think a lot of it comes down to the radiologist that ends up reading the imaging and writing the report. And so that, in a sense, is subjective.
Yeah.
And so that, that's, which also makes it more challenging for the neurologists and the neurosurgeons to know how to proceed. But Dr. Talagani, he'll pull up the imaging and look at it himself rather than going based on the radiology report. And I'm assuming Dr. Patel takes the same approach.
Yes.
Yes.
He will
Absolutely.
absolutely look at the images himself. I just had an MRI last week for, I have another growth in my brain that's not related to the pineal cyst, that we're just kind of keeping an eye on. And they actually had to push my appointment back because although he has the report from the radiologist, he doesn't like to just look at the report. He wants to see the images himself.
Well, that's not Dr. Patel. It's the
It's
our
a
other
different,
one, but yeah.
it's a neuro-oncologist at MD Anderson, but
Yes.
I'm just saying, yes.
Generally, they will.
Generally, they want to see them, and Dr. Patel for sure, he will definitely look at the images and
be more thorough.
and be very thorough.
I
He'll
was just gonna
usually
say.
pull them up.
Yeah.
He'll usually pull them up in front of you and kind of walk you through them.
Mhm.
So that was really helpful.
Yeah, and I would prefer having to experience delays, if that means that the doctors are being more thorough.
Yes.
Yeah, especially with brain surgery.
Absolutely.
For sure.
Yeah.
And I don't mean to interrupt your time here, but I do just want to say that I just got a text from Vicky, the mother of Emily, whom you all would have heard 2 weeks ago on a podcast, because for us, today was her surgery, and we interviewed her yesterday, and everything went incredibly well. She's out of surgery and she's doing good in a little bit of pain, but eye pain is all she's complaining of right now. So, yay.
Awesome.
Good job, Emily.
She's episode 3 or 4? She'll be Emily's episode, her first one. What number is that one?
4.
Episode 4. Okay.
Yeah.
I'm so
So,
happy to hear that. I saw your post about her and I've been thinking about her today.
Yeah, that's awesome.
Yep, with Dr. Patel. I'm glad to hear that it went well and that she's recovering.
Awesome.
Wonderful. Wonderful.
Every example of successful outcome makes me feel more confident about my decision and the next steps that I'm going to take.
I kind of thought you'd like to hear that.
Yeah.
It's interesting, talking to you guys is so much easier than talking to my friends and family about it. It really freaks people out.
Yeah.
Sure.
I don't talk about it very openly because I don't want to freak people out. And it's difficult to have these conversations because they get so emotionally reactive and that doesn't help. And I don't want to cause people stress. So in a lot of ways, I've kind of isolated and kept this to myself and taken on the stress alone. And so
We get that.
Yeah.
We had each other, but Kelly's symptoms were
severe,
extreme, very, very extreme. So if you ever listen to episode 1 and 2, it's a doozy. But so it puts us in a position of being able to, like I said, calmly talk about this stuff, cheer people on who are going in for brain surgery, and just be cool with it all, because this is, we don't claim to be experts. We've just been there.
We've lived it.
And we've talked to a lot of other people who have been there. And these experiences, everybody has their own journey and everybody has their own set of experiences, but there are these touchstones along the way that everyone has. And so you start weaving those together and you just get a feel for, okay, this is where this person is. And we're looking forward to your next step. And we definitely want to do a follow-up. Once all of this once you're on the other side.
Yeah. Be more than happy to do that. And it's just amazing. I'm not sure what precipitated this community to come together, that led me to you guys. But it's incredible that there is a community now where we can all gather and feel safe and have each other to talk to and validate each other. Reading all the testimonials in that group has been really eye-opening. For all the people who have seen Dr. Patel or had surgery, everybody's saying the same thing. There's no hesitation. There's no, nobody's regretting their decision to take this course of action, and that's really helpful. I saw that there was a lot of people that had the same story as me about the autoimmune background and doing a brain MRI to rule out MS as being the way that this was discovered, which brings me to another curiosity of, is there some kind of connection potentially there? Because during my journey of trying to manage not just what may be attributed to the pineal mass, but also all of the systemic inflammatory stuff from the autoimmune, I read some literature about how the pineal gland and melatonin actually do play an integral role in a functional immune system. Um, all my doctors are saying we don't know anything, and that's been frustrating for me because I can sit down and go on Google Scholar and there's tons of literature. And I guess I'm just going to take this on myself, and I'm happy that I was able to find these publications and, have a science background enough to understand what I'm reading. And what I've discovered is that there's a big possibility that all of these things are related. I've been diagnosed with osteopenia and I'm being followed for that yearly. There is a connection between the pineal gland and melatonin and bone density. So that is one thing I'm dealing with that has a high likelihood is related to the pineal mass. Also in the literature, I read about melatonin and its role in the immune system. The best theory right now that does have evidence to back it up is that melatonin actually triggers, other biochemical reactions and pathways. One of which is very specific, that triggers the production of two specific cytokines, whose role is to signal to the body and to the immune system that the threat is gone. You can turn off this immune response. And so I found that to be very interesting because that's exactly what I'm experiencing. My immune system's on overdrive. It doesn't turn off, and as a result, it's damaging other organs. And obviously, they're, hopefully by doing these types of podcasts and raising awareness, hopefully that leads to more funding and interest in research in these types of things.
We sure hope so.
Mhm.
We're gonna target these in a particular way that we've discussed on previous episodes, just to try our best to help make that happen.
Yeah, I've only been in the group in that community for about a week. It was last Wednesday that I saw the ENT and figured out that all of these symptoms that I'm having with the sinus pressure and the pressure headaches and the congestion are not are not a result of any kind of sinus disease or malformation. And so I immediately got home from my appointment and started trying to find avenues such as this group and this community, where I could find more resources and get pointed in the right direction, for seeking a treatment plan and hopefully surgery.
We're really glad that you found it, and we're really glad that you found us, and we greatly appreciate you coming on, because
Yes, thank you.
every single voice helps move this thing along, and all of these stories are valuable, and thank you.
Absolutely. And I guess part of me is just kind of coming to acceptance that um I'm not sure what my life and my career path, my future is going to look like, but obviously part of the divine plan for me is to participate in raising awareness, supporting advocacy, and dedicating myself to science and research, even if that presents some type of personal, if it leads to my personal sacrifice. I'm happy and willing to do that if that means that it's going to lead to better information and more accessible treatment for people who come after me.
Hmm.
That's something I'm happy to commit to and be part of. And that just makes me feel like this isn't for nothing, which makes it easier to cope with.
Kelly says the same thing about this podcast. She's mentioned just to me before that at least going through those 3.5 years of being someone else is taking on meaning now.
Mm-hmm.
That's very powerful after, having years of, questioning, what's my purpose? What am I doing this for? Why do I even exist if I'm going to be stuck in this holding pattern of debilitating symptoms and inability to function, inability to follow through with commitments, inability to reach for my goals. So it's learning to adjust, I guess, to our reality and discovering the meaning within all of that. And it may not be what it originally looked like for me as a young adult, taking on the world and figuring out my career path, but I'm coming to peace with that and acceptance.
Well, we absolutely, from our side, believe that you will come full circle on that because we've seen it and we've lived it and we've talked to so many people who've lived it. So I won't try to convince you of anything right now, but after a few months after your surgery, we'll have this talk again and see how you feel about it. So.
Perfect. I can't wait.
Thanks for listening to this episode of Pineal Stories, where patient voices matter and real stories have the power to drive change. If you or someone you love is living with a symptomatic pineal cyst, know that you are not alone. Our community is growing, and your experience matters. Share your story, connect with others, and help us push the medical conversation forward. Visit pinealstories.com to explore more stories, submit your own, and stay connected. And if you found this episode meaningful, please consider leaving a review and sharing it with someone who needs to hear it. Until next time, stay strong, stay informed, and keep speaking up. This is Michael Abels with my wife Kelly, and you've been listening to Pineal Stories. Thanks, y'all.